Wearing a white coat, an Atlanta doctor now understands the other side of medicine, what it's like to be a patient.
This after a blockage landed Grady Dr. David Anderson in open heart surgery. The Fox Medical Team's Beth Galvin is here with his story.
And Marissa and Tom, I think this was a really eye-opening experience for Dr. Anderson because he says he has never been really sick in his life, and he had no family history of heart disease. So it took him a few days to realize that he needed to get his chest pain checked out. As an internal medicine doctor, David Anderson spends most of his days here on his feet at Grady Memorial Hospital.
On average, I do about 2 miles a day when I'm here at the hospital, going from floor to floor.
So in January of 2017, when the now 61-year-old associate professor of clinical medicine at Morehouse School of Medicine experienced chest pain while walking in Midtown with his wife, Dr. Anderson figured it had to be the cold weather making his chest ache.
And when we stopped, the chest discomfort just went away. And I knew immediately then that this was not the cold air, this was angina.
Angina, pressure or squeezing in the chest, a classic sign of a heart blockage. But Anderson didn't want to alarm his wife, so he said nothing all weekend, and the pain didn't come back.
And I came to work like I would usually on a Monday, saw my patients here at Grady, and alerted my doctor to what was going on, and then the ball started rolling.
2 days later, Anderson was being rolled into a cath lab like this one, undergoing a procedure to look for blockages in the blood vessels of his heart. Afterwards, he turned to his wife, whom he'd finally let in on his secret.
I asked her, well, how did it go? And she would not give me an answer. She said, wait until the cardiologist, comes in to tell you the result.
Because Dr. Anderson had multiple blockages and would need open heart surgery. But he says he felt strangely lucky.
It could have been worse. I could have been going along my merry way and just had a massive heart attack that could have taken me out.
And Anderson's heart scare, he believes, has made him a better physician.
I was now the patient. It gives you a whole different perspective as to what patients go through.
In hindsight, Dr. Anderson says he probably should not have ignored his chest pain, but he says that's something physicians often do.
So my message would be, do not play doctor on yourself. Alert your personal physician. And Dr. Anderson says he feels fortunate that he didn't suffer any permanent damage to his heart muscle. He is working on getting healthier and improving his lifestyle. He says he's watching what he eats a little bit more closely. He's getting regular exercise, and most experts recommend that we get about 30 minutes of moderate exercise a day. So Tom and Marissa, that's walking, that's anything that can kind of get your heart going.
And it's funny because being a doctor, he's used to telling people to get it checked out right away, yet I guess if he had to do it over again, he would have gotten it checked out right away.
And I think that that's a problem. Sometimes it's a mistake that people make in just dismissing symptoms. When your body is telling you, when you are having chest pain or you are having pressure in your chest, your body is telling you something is wrong. Get that checked out. He waited 48, 72 hours, and he's a physician. So it just goes to show he's a guy, he's a doctor too. He did sort of the typical thing a lot of men might do.
And very risky too, and he talked about being active, walking about 2 miles a day as a doctor, and he still ended up with this issue.
And he still ended up with heart disease because heart disease can really happen to anyone. It's the leading killer in this country.
We're certainly glad he's all right. Great story. Beth, thanks.